The World Health Organization is meeting this hour in Geneva looking at how to fight the Zika virus. U.S. scientists are warning the disease has the potential to become a, quote, explosive pandemic. It has been linked to birth defects. The CDC this week added new areas to its unprecedented travel advisory, warning pregnant women to avoid places where the mosquito-borne virus is spreading. 10 cases have been reported in the U.S. this month. Dr. Anthony Fauci is director of the National Institute of Allergy and Infectious Diseases. He took part in a briefing with President Obama this week on the Zika threat. He's with us from Washington. Good morning, Dr. Fauci.
Good morning.
We now have over 4,000 suspected cases of babies born with brain defects in Brazil. I think the question everyone is asking is, could this affect the United States?
We do not believe that there will be a major outbreak of Zika in the United States. We don't want to be cavalier about it. We want to take it very seriously. But if Zika acts like the other types of viruses that are mosquito-borne that we've had experience with, like dengue and chikungunya, we will see little mini outbreaks like in Florida or in Texas that can be well controlled with mosquito vector control. Hopefully, we will not see anything worse than that. But we have to be very vigilant. But again, we don't expect a major outbreak in the United States, despite the fact that there's considerable problems in South America, particularly in Brazil, with a widespread outbreak of Zika.
What is the urgent response that is necessary at this moment?
Well, right now, the urgent response is really vector control, namely to make sure that the mosquito vectors really are controlled. And you can do that by eliminating them, trying to eliminate them with insecticides. What we spoke to President Obama about in our meeting was the kind of countermeasures, better diagnostics, the development of vaccines, being able to understand the virus better, vector control, and things like that he was very interested in.
And let me ask you, Dr. Fauci, I know that this is overwhelmingly spread by mosquitoes, but I know that the CDC has reported at least one case with this is spread by other means. Are you concerned about that?
We do not believe that there's major ways of spreading this apart from mosquito bites. Right now, the considerable thing that we're concerned about, as you're well aware, is the devastating sequelae that you see in pregnant women who get infected while they are pregnant. And that's the reason why the CDC has come out with their guideline of telling pregnant women or women who think they might be pregnant or getting pregnant to avoid, unless absolutely necessary, travel to those regions where you have the local spread and the outbreak of Zika.
Important information. Dr. Anthony Fauci, thank you so much.
You're quite welcome.